Good evening, everyone. I'm Deanne Mazzochi, the state representative for the 47th District, and I am very grateful that you've joined us tonight, and maybe you'll be watching us later so that we can talk about healthcare and health insurance issues and options that are available to you. We know that there's been an incredible amount of turmoil in our lives these last couple of years, as well as a high rate of turnover in the job market. So I thought it would be especially important to host this seminar because many people do have questions about the healthcare options that exist outside of employer-provided options. And I want to make sure that you can make informed decisions as much as you can. Tonight, we're going to allow you to leave comments and provide questions either in the comments of the Facebook Live page, or you can do it right here down below in the Zoom chat. So at this point in time, because I want to make sure you spend as much time with our experts as possible, I'd like to turn everything over to Laura Pellick with Get Covered Illinois, who is going to start the presentations off tonight. And hopefully she and Lauren, who are also with her, are going to be able to answer your questions. Thanks so much, everybody. And Laura, over to you.
Thank you so much, Rep. Mazzochi, and thank you so much for this opportunity to share some information about your health insurance options for plan year 2022. And I'm joined tonight by my colleague, Lauren Polite from the Department of Healthcare and Family Services. I'm going to start the talk off talking about the ACA marketplace, and then Lauren will talk about Medicaid. So I'm going to go ahead, switch off my camera for a second and start the slides. So just bear with me for 1 second. Okay, everybody hopefully can see my slide, my deck here. So as I mentioned, we are going to talk about your health insurance options for the plan year 2022. Sorry, I'm jumping ahead. We're going to talk about the Affordable Care Act. Most people have heard of the Affordable Care Act, also called Obamacare. It's one and the same. Just to kind of give you a refresher, if you're not familiar with what that means and what it covers, we're going to talk a little bit about Get Covered Illinois and the ACA Health Insurance Marketplace, just to kind of understand how it may be different from other options you have to purchase health insurance. And then Lauren will talk about the application for benefits eligibility, also known as ABE, and those are the Medicaid programs that are available. And then we're going to talk about something that's super important, which is the free enrollment assistance that is available. So we'll get started about the Affordable Care Act. So the Affordable Care Act, also known as ACA, provides for affordable coverage through the ACA Health Insurance Marketplace, in our case in Illinois, also known as Get Covered Illinois. And it's actually private insurance. So this is not insurance that is provided by the government. The government helps regulate to make sure that the insurance companies that are providing the private insurance are meeting the requirements of the Affordable Care Act. And the marketplace is also where people can find out if they qualify for financial assistance to help pay premiums if you qualify. And then also the Affordable Care Act is very important because it allowed us to have Medicaid expansion. In previous years, Medicaid was offered to adults with children, and now if you qualify, depending on your household income, adults can also qualify. And that has been the case for several years now. We're fortunate that in Illinois, we have this Medicaid expansion to help more people get coverage. So the ACA Marketplace health plans increase consumer protections in multiple ways. The ACA Marketplace, or the Affordable Care Act, established 10 essential health benefit categories, which we'll go over in just a minute. It provides coverage for people with pre-existing conditions. So prior to the Affordable Care Act, people could actually be denied health coverage because maybe they had cancer before they enrolled in a plan or had another pre-existing condition that they could be turned away. So that is no longer the case, and it has not been the case since the Affordable Care Act has been passed, which is huge for millions of people. It also eliminates annual and lifetime dollar limits. So there's actually a cap on how much you have to pay out of pocket before, and then the insurance company will help start paying. So in the past, those costs could have been pretty high, leading up to the insurance company paying some of those costs. So the essential health benefits include some really important benefits that most people need throughout their time taking care of themselves or their family members. These essential benefits include ambulatory care, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drug coverage, rehabilitative disease management, laboratory services such as blood work, preventive wellness services, and chronic disease management. So when you have an ACA Marketplace plan, there is preventive screenings and wellness appointments that are covered as part of your plan that you don't pay additionally for or pay out of pocket for. It's covered with your premiums. And then pediatric services, including oral and vision care. So now we're just going to talk a little bit about Get Covered Illinois and who can get covered through the marketplace. So Get Covered Illinois is the exchange for the state of Illinois. It is also part of the federal marketplace. So if you've heard of the website healthcare.gov, that's where we actually connect you when you're choosing a plan. And we're going to show you how to do that in just a minute. But in terms of who can get covered through the marketplace, you can enroll if you live in the United States, and in this case in Illinois, if you're a US citizen or national, if you're not incarcerated which means in jail at this time, and you do not have health insurance through an employer, through Medicare or Medicaid, through the Children's Insurance Program, or other source that provides qualifying health coverage. So when can you enroll in the marketplace? As we discussed at the beginning, we're actually underway with the open enrollment period for next year. It started on November 1st, and it goes through January 15th of next year. However, if you currently have health insurance and you do not want to have a lapse in coverage for starting in January, you really do need to enroll by December 15th of this year. If you enroll by December 15th, you will not see a lapse in coverage and your coverage will start on January 1. However, you do have until the 15th of January. And if you enroll after December 15th, your coverage will start on February 1st. So please keep that in mind since we're still in mid-November and you have time to leave a whole month to still look and compare plans to try and get that done before December 15th if you can meet that deadline. And then I'll just briefly mention the special enrollment periods. Those are for folks who maybe have health insurance during open enrollment period, but something changes after January 15th of next year. You experience a job loss, maybe you get married or divorced, or you have a baby, you move. There are certain qualifying life events that would allow you to enroll in a new plan. You have like a window of 60 days after that life event to enroll. So now is the time to enroll for sure, but keep that in mind if you have any changes in your circumstances after January 15th. So something very important to the marketplace is the free enrollment assistance that is available. In terms of who can help you, we have local assisters who can help educate you about the different types of plan coverage. They can answer questions and help you enroll. So everybody's got their own specific questions depending on their circumstances. That's what the local assisters and navigators are for. On the GCI website, which I'll show in a second, all you need to do is punch in your zip code to find people that can help you that are certified and trained in your local area. Navigators, very similar to local assisters. Those are people that are funded by the federal government. They're trained and certified to help answer questions. And they can help you find and apply for health insurance again through the marketplace or AIB. So in terms of where to find the local assistance, if you go to getcoveredillinois.gov, up in the menu on the top of the screen, you'll see a choice for Get Free Help. There's actually a tool both in English and Spanish. When you click on that, it'll scroll down and you'll have two choices. But you can enter in your zip code. This image on the right-hand side is what you'll see when you click on that button. Type in your zip code. It'll give you a list. You know, there's 25 miles away shown on the screen, but I think they can go down to at least 5 miles, and you can expand that range to see how many are in your local area, and then also your language preference. And I would just add that right now during this open enrollment period, when you call, you'll see there's a list of locations plus their phone numbers if you prefer in-person assistance versus doing it over the phone, different locations are offering multiple options, including even doing a Zoom call if you want to do it virtually or you want to do it by phone. And as I said, there may be some opportunities to go in person if that's your preference. So I mentioned earlier briefly that Get Covered Illinois connects you to healthcare.gov. So healthcare.gov is the federal website where you actually will compare plan prices, benefits, and enroll. Every plan covers the essential health benefits that I mentioned, which include the doctor's visits, preventive care, prescription drugs, and hospitalization. And this is the place where you can find out if you qualify for financial help. And I would just say that when you're on the Get Covered Illinois website, if you click on Shop and Enroll, it will help guide you. I'm kind of jumping ahead. We're going to get to that. So hold on that because I have a screen that explains what page to go to and what to click on. But first, let me mention the financial assistance and how we refer to the financial assistance. Premium tax credits, PTC, is refundable credits that can help cover the cost of your monthly premium payment. This term has also has a couple other names, including subsidies or discounts. So when you hear those terms, we're referring to premium tax credits. And the only way to get these premium tax credits are for plans that are purchased on the ACA marketplace. This year, an act was passed, the American Rescue Plan, and some of the provisions that were provided are including some provisions specific to the ACA marketplace. The economic stimulus bill increases eligibility for consumers to qualify for financial assistance to help pay for your ACA marketplace plans. So the financial assistance is available in the form of these premium tax credits, as I mentioned, and consumers will be able to take advantage of these increased PTCs on these high quality healthcare plans. An estimated 130,500 uninsured Illinois residents are now eligible for subsidies to reduce the cost of premiums. So people might ask, like, how and when do I apply for these savings? They started this year in 2021. They became available like in the spring. So some people had gone in and updated their plans for this year. If you had a marketplace plan and didn't do that this year, these savings you'll see during tax time, but for 2022, when you're applying now, you'll find out if you're eligible to receive these increased premium tax credits. The premium tax credits, as I mentioned, are for coverage this year and will continue through 2022. So to receive these premium tax credits, as I mentioned, you must buy your health insurance directly through the ACA marketplace, which is getcoveredillinois.gov. And like I said, we'll connect you to the healthcare.gov. So in terms of how premium tax credits are calculated under the American Rescue Plan, the calculation uses a percentage of a household's income that needs to be contributed on a monthly health insurance premium. And under the American Rescue Plan, you may be eligible for a temporary increase in these premium tax credits. So if you already got premium tax credits in the past, that just means that you will qualify for more. And people who maybe didn't qualify in the past could possibly qualify this time, with no one paying more than 8.5% of their household income toward the cost of the benchmark plan. So in past years, you could have paid more than 8.5% of your household. So it's definitely worth the exercise to go check out the plans, see the costs, and see if you qualify for this financial help. So I started to jump ahead on this, but I had mentioned that if you start at healthcare.gov, you're not sure if you qualify for an ACA, and not qualify, but if it makes more sense to get a marketplace plan or a Medicaid plan, all you have to do is answer 3 simple questions when you click on Shop and Enroll. And based on those answers, we can help direct you. So we can help take out some of the guessing. If you qualify for Medicaid, we will send you, give you a link that takes you right to the Medicaid. And if it's a marketplace plan, then you would just go directly to the marketplace. For those folks who are already on the marketplace and know that they don't qualify for Medicaid, there is a link at the top of the page that you can go just directly to the marketplace. And with that, we're going to get into more information about Medicaid, and I'm going to hand it over to Lauren.
Thanks, Laura. So as Laura mentioned early on, under the Affordable Care Act, states had the opportunity to expand Medicaid to cover more people. And so Illinois was one of the first to do that, I'm happy to say. And so to make it easier to apply for Medicaid and other benefits at the same time, Illinois stood up an online application called ABE, the Application for Benefits Eligibility. And so this is the home page, and you'll see the URL at the bottom. So the website is just abe.illinois.gov. And on the right there, you see that you can apply for multiple programs through ABE. So all of our health benefit programs, the Medicare Savings Program, which is for people who are on Medicare, who are low income and may need some help paying for their Medicare premiums. Our SNAP program, which is food stamps in Illinois, and then cash assistance. So again, you can apply for all benefits on ABE. Also on the bottom there's a phone number, that 800, no, that's okay, you're fine, it's on both pages, 800-843-6154. And so you can apply over the phone as well. So similar to the marketplace benefits that Laura mentioned, Medicaid also covers a comprehensive benefit package, which we'll get to. But these are all of the health benefits programs that we have in the state of Illinois. And so I have this slide here just to show that there are different sort of categories of eligibility types. So depending on the population, there are different programs, and those programs have different eligibility requirements. So while we're very fortunate in Illinois to have a lot of programs to offer coverage to a lot of people, it can get a little bit confusing. So I just wanted to, explain that we do have, a program for children. We have a program for parents and caretaker relatives of those children, and those are kids up to 18. Our DCFS and foster care, and then moms and babies. We have, it's really to make sure that our pregnant women receive, as much prenatal care as possible. And then Illinois just extended to extend that coverage to mom for 12 months after she gives birth, to make sure that she gets all the follow-up care to stay healthy. The ACA adult category is that category we mentioned where we were able to expand under the Affordable Care Act. Aid to age of blind and disabled, and that is for people, again, over 65 or over, or blind or disabled. And that is eligibility is determined differently for that category than it is for the others described earlier. Illinois also has a program, first in the country, for coverage for immigrant seniors who are 65 or over. And those are individuals who would not have otherwise qualified for Medicaid because of citizenship and not having been here as legal permanent residents for 5 years or more, which is a standard eligibility requirement. And then others who are not eligible, we always have emergency medical to cover costs of again, an emergency, cover costs in a hospital, health benefits for workers with disability, veterans, and then some other smaller programs specific to certain circumstances. So next slide. So how do you know if you qualify? So in general, there's sort of 3 general requirements. And again, these differ depending on the population. But everyone does need to be a resident of Illinois. So you have to be able to prove residency, either by, an ID, a license, or, a bill, a lease, something like that. And then there's eligibility, income eligibility. And income eligibility is based on family size and monthly income. So Medicaid looks at monthly income. We look at the last 30 days of income. And this does vary from the marketplace. The marketplace looks at sort of what you're expected to make in the 12 months, the next 12 months. And so there is some slight, there's a difference. So if you were unemployed last month, you would, likely qualify for Medicaid. But if you, get a job or expect a job in the future, then you would become eligible either for employer-based coverage or, as Laura mentioned, maybe a special enrollment period. So, in that case, again, what we would say is don't hesitate to apply. Go ahead and get on Medicaid if you're eligible based on your last 30 days. And then once your situation changes, you alert, Medicaid that you may be making more money, no longer eligible, and then that gives you a special enrollment period on the marketplace. So we don't want you to wait, delay in getting coverage. The last requirement is citizenship, but the citizenship requirement again depends on the population. So I've listed here sort of some of the differences. So adults up to age 64, so 19 to 64, have to be either a citizen or have a legal permanent resident for 5 years, or be a covered refugee. 65 and over, now that we passed the Immigrant Senior Program, the legislature passed the Senior Immigrant Program, no longer has citizenship requirements. So if someone is a citizen or has been here for 5 years as a legal permanent resident, they would be in the AABD program. If not, they would be in the Senior Immigrant Program. And there's a slight difference in benefits for those two, but the eligibility criteria are the same. Children and pregnant women, we know it's so important for children and pregnant women to have coverage that we do not have citizenship requirements for those two populations. And then just really important to know that the citizenship of the parent who is applying for benefits for their children, so the parent is not applying, they're just applying for the children. We do not look at the citizenship of the parent when we're processing the application for the children. So since we don't have a citizenship requirement for the children, and they're the ones that need the coverage, please, just don't hesitate to apply for children's coverage, because we know how important it is for them to have coverage. Here's the monthly gross income qualifications. So you can see, again, as I mentioned, sort of the children's income eligibility is much higher, and that's because a while ago now, Congress passed the Children's Health Insurance Program, which gave states money to expand coverage for children. Illinois took advantage of that. So that is significantly higher. The parents and the ACA adults is lower. And then the moms and babies is sort of in between. The aged, blind, and disabled and immigrant seniors is the lowest. That's right at 100% of poverty. But then we do have the programs to help pay for Medicare, and those folks are most likely to be on Medicare because they're primarily 65 plus or meet Medicare requirements if they're disabled. So that is the lowest income eligibility, but we do have the other programs to help pay for Medicare premiums. And so again, this is based on monthly gross income, and Medicaid looks at the last 30 days. And just as Laura mentioned, there's no time limit on applying for Medicaid. So you can apply for Medicaid 12 months out of the year. And the month of application, so if someone's determined eligible, then coverage starts the first of the month in which someone applies. So if someone would apply today and they were determined eligible, coverage would go back and start November 1st. So if there were any sort of outstanding bills that weren't paid, then those could be, someone would call and have the provider submit those to the state because of eligibility. Okay, next slide. So this is just the Immigrant Seniors group, and this just gives a little more information on that population. We're in a public health emergency still for COVID, and so we are not looking at the number 4, the assets, and so those are waived during COVID, but those are just the general requirements. So we can go ahead and move ahead. These are other changes that we made during the public health emergency, just to try to make sure that as many people as possible get coverage. We know obviously it's, critical now more than ever with COVID and the possibility of needing sort of enhanced healthcare to treat COVID. And so we took advantage of federal funds to keep people on Medicaid as much as possible. Also waived premiums and co-payments for any programs, specifically like the Children's Health Insurance Program at the higher income levels had premiums and co-payments. And we also were not mailing redeterminations. And so if you are wondering, if anyone is on Medicaid and was wondering where that redetermination is, we have not been mailing them. Once the public health emergency is over, we will begin to mail them again. So everyone should always keep an eye out on their mail. And also, please make sure that the state has any change of address, because that's the way we communicate still through the post office. We're also able to take more phone applications, and there are the certified application assisters, many of whom are the sisters that help on the marketplace side, who can help over the phone. And then from a services perspective, we have greatly expanded telehealth options under Medicaid and suspended some prior authorization requirements. So. COVID testing, treatment, and vaccines. What's on everybody's mind is covered. Medicaid and Medicare covers COVID testing and treatment. Everything's at no cost now. As I'm sure people know, everyone ages 5 and above can get a COVID-19 vaccine, and the state uses vaccines.gov, G-O-V. And it's very easy to use, and you put in a zip code and it finds a location near you, and also shows what types of vaccines are available, whether it's a Pfizer. If you're looking for 5 and above, it's only Pfizer or Moderna or J&J. So encourage everybody and help your friends and neighbors go to vaccines.gov to find a COVID vaccine appointment. And then emergency medical is for non-citizens who may or may not have COVID-19, but they, meet other Medicaid eligibility rules. So the point is that there are a lot of opportunities for providers to submit bills for COVID testing, treatment, or vaccines. There should be no cost to individuals for especially testing and vaccines. And then treatment, again, there's a couple opportunities for providers to submit bills for uninsured individuals, but we don't want anyone to hesitate getting the treatment they need. Medicaid covered services are very similar to what Laura talked about on the marketplace. And especially for children, we have very good diagnostic and therapy coverage. The most important difference is transportation. Medicaid covers transportation to and from medical appointments, including COVID-19 vaccinations. So very comprehensive services available through Medicaid. In Medicaid, for about 80% of our population, people are required to enroll in a managed care organization, and they offer the same range of health services, and they waive, but in fact, they sort of do more than what Medicaid fee-for-service does. They waive co-payments, they offer extra benefits, they offer sort of, gift cards for attending, prenatal care visits and sort of getting all the care the preventive care that someone needs. And it can also help find providers and transition members out of the hospital or facility. And everyone is required to have a primary care provider. Okay. And these are our managed care choices in Illinois. So, and you'll notice that many of them are large, sort of multi-state commercial plans as well, but these are our Medicaid plans. So people will have the choice. If someone lives in Cook County, then they also have the choice of county care. County care is specific to just Cook County. So outside of Cook, it would be the first 4. Inside of Cook, it would be all 5 plans would be an option. Okay. And these are just some other state agencies that HFS works with. So HFS is the Medicaid agency where sort of the regulator and the policy setter. The Department of Human Services is our sister agency. They process many of our applications, and they also administer the SNAP and TANF cash assistance program, as well as a lot of other small programs that are really beneficial for the population. And then we work closely with the Department of Public Health, specifically on COVID-19. They're the lead agency on all the COVID-19 guidance. And then we just wanted to give you some additional resources here, and just for your information, and to hopefully answer questions that you have.
Thanks, Lawrence. So this is at the end of the presentation, and we are happy to answer any questions that people might have.
Okay, sounds like there aren't any questions out there. So I think just one other thing I wanted to point out, from just as far as the connectedness between Medicaid and the marketplace. So if someone applies on healthcare.gov, and make sure it's healthcare.gov. I got a call the other day for healthcare.com, and I thought, oh, that's not good. So it's healthcare.gov. But if you apply for healthcare.gov and then they assess you as possibly eligible for Medicaid, they will send the application electronically over to the state for processing, and they won't let you really proceed until you get a denial from Medicaid. So once you get a denial, you can go back to the marketplace, but the denial has to be for over income. So it's really just important to understand conceptually, you're either eligible for tax, subsidies on the marketplace, or you're eligible for Medicaid, but you cannot be eligible for both. So you go into one program or the other. And if you are on both, then there can be challenges. They might, you might be asked to pay back some premium tax credits or things like that. So it's really important to, keep an eye on your mail, make sure you're only getting coverage through Medicaid or the marketplace, and not both. And Get Covered Illinois can certainly help you navigate that, or we can help from the Medicaid side. But coordination. So while you can enter and go through no wrong door, either Medicaid or marketplace, it is important that you end up only in one of those rooms.
Yeah, and just to add to what Lauren said, depending on what plan you choose, you can know that any plan you pick from the ACA Marketplace and Medicaid will cover all the 10 essential benefits that we discussed. So just know that not all plans will cover all 10 essential health benefits off the marketplace. And, when you're looking, to make sure you're getting that coverage, and you're assured that coverage if you go to either Medicaid or to Marketplace. And then I would just say one more time to remember that the deadline to have coverage start January 1 would be on December 15th. So you have a month. There are more navigators this year because of additional funding. So there's plenty of help out there to help answer questions in different situations. And even if you had a marketplace plan this year, please go in and take a look at it. You will be auto enrolled into the closest plan there is from this year if you do nothing. But we really suggest, because there's new providers, we have 11 insurance carriers this year. There were 9 last year. There's more plans out there. Just kind of look and see which one is best for your family for 2022, and just take the time. So, and that'll be it.
Thank you, everyone. Have a nice Thanksgiving.
Yeah, thanks everyone, and yeah, happy Thanksgiving to everyone. You as well, Lauren.
Thank you. Thanks, Laura. You too.